following claims that one known drug could have amazing effects. So as researchers prepare for human trials, we ask, how close is a miracle cure? And what are the ethical dimensions of pursuing one? Hello, I'm Taimur Nabili, and this is Between the Lines. The quest for longer life has been the stuff of dreams for millennia. But now there's speculation that one drug might provide a giant leap towards that goal. It's called metformin, and it's already one of the world's most widely used medications, but until now it's only been prescribed for diabetes. But lately researchers discovered that it has remarkable effects on mice, increasing their lifespan by almost 40%. By apparently slowing the very process of aging and reducing age-related diseases. So now they're going to test it on humans. And already there's talk of living to 120 and the near eradication of conditions like Alzheimer's disease. But how realistic are those claims? And what would be the broader practical and ethical results of denying natural death? Well, joining me for the discussion are, from New York, Dr. Stephen Ostad. He's the scientific director at the American Federation for Aging Research and the author of the book, Why We Age, What Science is Discovering About the Body's Journey Through Life. Here in Singapore, I'm joined by Dr. Jan Gruber, an assistant professor of science at Yale NUS College and the Department of Biochemistry and Neurobiology and Aging Program at the National University of Singapore. Gentlemen, thank you both for being on the program. Stephen, let me begin with you, if I might, over in New York. We're talking here about a drug that is, we're told, may be going to be effective on any number of ailments, one of them being death, or at least for a short time. Anyway, how realistic is that claim? I mean, why are suddenly these huge claims being made about a drug?
Well, the reason is that there's some very promising animal work, but there's very promising animal work for a number of drugs. This one actually shows some promise in humans as well. As you pointed out, it's already used by millions of humans who are diabetic, and those people, it turns out, have many signs that show that they may in fact be aging more slowly. So we would like to investigate that more formally.
So these human trials that we're talking about have already been underway in a certain aspect. So what difference are the new trials going to, how different are they going to be?
Well, the existing work is what we call observational. That is, we would just follow people that are taking the drug versus people that aren't. And scientists don't really feel that that's the strongest kind of evidence. The strongest kind of evidence is when you do an experiment and you randomly assign one group of people to take the drug and randomly assign another group of people to take a placebo. That's never been done for any putative anti-aging drug before, so this would be brand new.
All right, so just bringing a more methodical approach to examining the effects. But Jan, how convinced are you by what the evidence that we've seen thus far?
I think the exciting thing about metformin is, and similar drugs, that they're human drugs that are in human use already, that we have a good safety record for. And all the evidence from all the animal models, from mice or flies to worms, shows that they are protective against many age-dependent diseases or conditions, and that this may slow down aging rate. And we also know from mechanistic work that there's good reason to believe that they should. So I think the exciting thing is that there are therapeutic agents already in clinical use that might be efficacious, and that's a new thing.
Call me a skeptic, but you know, there's one thing between saying, okay, we've seen suggestions that perhaps there may slow down the aging process to a certain extent, and another to have these stories that we read in the press where they're actually saying things like, you'll live to 120 and we're going to cure Alzheimer's and Parkinson's and kidney disease and diabetes, which people are actually saying.
Well, I think certainly pulling out numbers like 120 is, you know, I don't know how scientific that is to pick a particular number, but I think it's important to realize that at the moment we have very few preventative interventions that we can use to prevent somebody from getting Alzheimer's disease, and there's good evidence that this may now be on the horizon, and I think that's very exciting. So slowing down aging rate as a way of preventing onset of diseases is a a very exciting alternative to waiting until you get ill and then spending money and time on just slowing down the decline.
But again, just theoretical. Because, Stephen, I mean, what happens if we test these things on humans and discover that, in fact, they don't really do what is promised?
Well, I think that's a very plausible outcome. Most experiments on humans, most clinical trials fail. The important thing is to really establish a protocol for examining these kinds of drugs. And in the past, people assumed that we would have to give them to people and follow them for 50, 60, 70 years. And we're using a different approach, which is to take people that are already reasonably old but healthy and starting the drug then. Therefore, we think we can really figure out if it's working in 5 years or less, which is a new approach.
It's not the first time that we've had claims like this, is it? I mean, it wasn't more than 4 or 5 years ago when there was another drug on the market. Time magazine ran a piece on it saying that this was going to slow down aging.
Which drug?
Yes, well, you can never stop people. Well, yeah, rapamycin is still a very viable candidate, and it's probably going to undergo the same kind of testing in the future. The thing is, it's not currently used by millions of people like metformin is, so we're not quite as clear on the safety profile. And certainly we don't want to give healthy people drugs that might have side effects that we didn't anticipate.
So from the work that you're doing on anti-aging here, I mean, are these the only two things that are on the horizon?
No, there's a large number of things that we think, from understanding the pathways involved, might do something to aging rate. There's a lot of interest in developing these things in a preventative modality. But again, the point is that this is one thing to do an animal experiment where if it goes wrong and you have side effects, you just don't worry, you say, okay, this didn't work. It is much more difficult to do something in the clinic. And so taking drugs that are already in clinical use and then investigating potential anti-aging type or mortality decelerating or disease preventative modalities is a very exciting way of doing this.
The rapamycin tests that they have done already, from my understanding, did show considerable side effects. What are the dangers of testing drugs like these on human beings?
Well, I mean, you wouldn't test them without first looking at the risks very carefully. But for instance, in the rapamycin, it's, I think, more a theoretical concern regarding the fact that this is an immune suppressant. So there's worries that it might have detrimental effect on that account. But I think the trials that have been done with low-dose rapamycin seem to not bear that out. So neither the mice in the rapamycin study, if I'm not wrong, and this is not what I've done, show immune suppressant, nor do people who treat with low-dose rapamycin show, more susceptibility, for instance, to infection. So in fact, I think there's one trial where they showed that your ability to respond to a flu vaccine is better with rapamycin treatment than without. So I actually think rapamycin is another interesting and very exciting candidate in this context.
In individual drugs aside, Jan, tell me what your research into anti-aging tells you about how the human body responds to living longer. I mean, maybe if we prolong aging or put off aging, then we put off age-related diseases like Alzheimer's. But are there other effects that living longer brings with it? I mean, can we just continue as if everything else were equal?
Well, I think the idea that it might be possible to modify basic aging rate implies that you're basically younger than your chronological age, right? So if that were to be done, and we have surely not shown that this is possible in people yet, but if we were able to do this, it would mean that you're biologically maybe 50 when you're chronologically 70. And there's really very few disadvantages I can see with that strategy. And I think we're certainly seeing it already in the fact that people would have been considered to be too old to take responsibility, too old to take part in society, now play important roles and for much longer periods of time. And I actually think it's important to not view the elderly as a sort of thing that we want to get rid of as quickly as possible, but to realize that it is an important part of society, an asset to society, especially when they're healthy. And especially in Singapore, they are the history of the country, for instance.
But I guess what I'm asking is there, and Stephen, let me put this to you, is there such a thing as a natural age? I mean, after all, genetically, if I'm not mistaken, we are programmed to stop replicating cells and to stop being young, if you like, and to begin getting old by genetics. If we deny that, would that not have its own side effects?
Well, that's an experiment that's in progress. If you think about it, human life expectancy has been increasing by 6 hours a day for over 150 years. So we've already conquered many of aspects of aging. Now, what's going to happen if we go beyond this is not obvious, but I think it's important to note that there are certain people that live to 100 years or older that are in excellent health. And so they show us that at least the possibility is there for us to live much, much longer and remain in excellent health.
And John, before we let you go, how long might we push that then? If there is not really any detriment, or at least it's possible for the body to survive much longer than we imagine, is it possible to make that indefinite?
So I don't want to answer that question as you posed it, because I don't think that is the important question. I think what is important is that as populations around the world age, and as we stop having as much offspring because we don't want to grow the world population beyond any limit, we will have to live with a world where more people are much older. And we want those people to be healthy and productive rather than in need of care and dependent. And there's one sort of simulation that says if you decelerated aging rate by only 20% in the US context, you would save something like $7 trillion. So I think it is not necessary to think about scenarios of immortality and stopping aging to realize that this would have dramatic beneficial consequences on the world.
All right, well, we'll talk about the consequences and the impact on the world in part two. Jan, thank you for being on the program with us. We'll say goodbye to Dr. Jan Gruber, and when we come back, we'll consider some of the ethical elements and the practical impacts of aging for longer on the planet in a couple of minutes. Welcome back on Between the Lines today. We're talking about a miracle drug, or at least that's what they're calling it, because it has, it seems, the potential to extend human life. But is it desirable to achieve such an outcome? Still with me on the program, Dr. Stephen Ostad in New York, and now for part two, joining me in Singapore, Dr. Dinesh Nair, a cardiologist at the Heart Matters Medical Center at Mount Elizabeth Hospital in Singapore. Dinesh, welcome to the show. Let me begin with you, if I might. This ethical question of whether we should really prolong human life that some people seem to have trouble with. How do you deal with that? I mean, your job is to prolong human life. Do you find that ethically troubling?
Thank you for having me, first of all. I don't find it troubling at all. What I do on a day-to-day basis, every single day, is I try to prolong life and I try to improve the quality of life of my patients. So I'm a cardiologist, so if someone came in with a heart attack and they had blocks in their arteries, and I needed to open them up, I'd open them up, I'd hopefully save their life, and I'd prolong life. So this is what I do every single day. So I don't see why this is any different, because if you could take a pill and prolong your life, but at the same time improve your quality of life, I don't see this as being any different.
Well, one of the conundrums that some people bring up is the idea that not everybody has equal access to that life-prolonging capacity, treatment, option. So in order to favor one over the other will create an unequal world, both morally and practically.
Actually, there is something to be said about that. But in truth, not everyone has access to all the same medical care all over the world anyway. Many people have access to medical care and many people don't have the same access that we have here in Singapore. But that doesn't mean that we should deny those who have it here from getting that extra treatment that they need. So prolonging life, improving quality of life, we should strive to give it to everybody that we can. We should strive to create an infrastructure that allows everyone to have access. But at the end of the day, I agree with you. There is this issue where some people may not have access to it as well. But this is something that's very interesting with regard to this drug, though. This new drug that is being studied is actually not very expensive. A lot of newer therapies tend to be very expensive, tend to be inaccessible to people. This new drug, metformin, we've been using it since the 1950s, maybe even earlier, and it actually only costs a few cents a day. So in actual fact, it isn't one of the most expensive drugs that we can have out there.
Let me just talk specifically about your discipline, though, for a second, because one of the things about metformin, and we'll go into this a bit more in a second, is the fact that it seems to help in so many different areas, whereas you're specifically focused on cardiology. So the question arises, if you prolong somebody's life by repairing their heart, in certain senses, maybe you're leaving them open to suffering from something else. I mean, just again, exploring that moral issue a little bit further. Is that a consideration, or am I just like digging around in irrelevant spaces here?
I think it's always a consideration. At the end of the day, as doctors, we take an oath to preserve life, to protect, to prolong life, to improve quality of life. Now, we have side effects with everything. So let's say you give somebody a medicine that prolongs their life. Perhaps there's going to be a side effect to it. What we do is we explain that to the patient, make sure that they can make an informed choice regarding this treatment that we're giving them, and then we leave it. And that's what we do on a day-to-day basis. So if you had to treat somebody with a cholesterol drug and they developed muscle aches and things like that, you might have to give them other treatments for the muscle ache. But that doesn't mean you don't give them that life-saving drug as a result.
Stephen, in the US, what's the state of the ethical conversation around this right now?
Well, I think those are excellent questions, and I think this is something that we need to discuss. I really would like to point out that one of the reasons we chose metformin to do this first clinical trial for its anti-aging effects is because of the safety and also because of the cost, because it's very legitimate. We would like to have, if we discover something that really does extend the quality of human life, we'd like it to be available to as many people as possible.
In your experience, I mean, let's go back to the efficacy of this proposition, the idea that maybe this drug actually does what it claims to do. I mean, you've been in the health business for an awfully long time. You deal with some of the most intractable problems of human health. I mean, the cholesterol problem has been with us for an awfully long time, and we're still struggling to find a way to not only deal with that, but also actually measure exactly what its impact is. How much do you believe the idea that there is a miracle drug out there?
So that's the million-dollar question, or trillion-dollar question, if you will. We don't know if this really works. That's why we're doing a trial. But all the data points towards the fact that it may work. A recent study that was published that prescribed metformin for diabetic patients showed that they lived longer than what was projected for that cohort or that group when compared to those who didn't have diabetes. And that's why there was a little bit of a proof of concept at that time. And that's why this drug is being used. But at the end of the day, there are thousands of other drugs that have gone through trials that have not shown a benefit, that were supposed to be the holy grail, if you will. And this is just one of them. But if it were to be proven at some point, it'd be great. But that doesn't mean we won't stop searching for it. We've always been searching for the fountain of youth, if you will.
Well, I mean, let's move aside from the medicine for a second and just speculate for a bit on what it might mean if it does work. Because we already have a society where aging is a major problem. All the developed countries, and even a lot of the countries in Asia, are reaching demographic conditions where we've got more old people than young people. And this drug is going to not only exacerbate that, but also put added stress on food resources, on planetary resources, and that kind of thing. Is that something we should be concerned about, do you think?
So I'll put something else to you. What if we change the definition of what old is? You know, when you go to a birthday party these days, if someone's turning 70, they say 70 is the new 50, 50 is the new 40, 40 is the new 30. If we change the definition of what old is, and if you can live to be 70 years old and be as fit as a 40-year-old, you don't have the same issues. You can function like a 40-year-old. You could continue in the workforce. Sure, we might have overpopulation, we might have other things, but then overpopulation happens for other reasons as well. So if you could get a functioning population with the experience and the ability to continue into an older age, continue working perhaps for longer, why not? Now, one of the problems with that, of course, is can we afford it? A study was done, and I think your previous guest mentioned this, that there was a study that was done. It's a projected study, it's not really proven, that the society may actually save money with a well-aging population because you reduce the number of diseases that you're treating.
For sure. I mean, the health costs would presumably be less if we're all more healthy. I'm just wondering about the cost of consuming the Earth's resources, because that, as Maslow pointed out an awfully long time ago, and he didn't get a great deal of credit for it and still gets a lot of dissent for it. But at the end of the day, there's got to be a limit.
Well, if we keep increasing the population at the rate that we're doing, fair enough. If you increase the age of a person by about 20 years, you will increase the number of people living on Earth and using up resources for sure as well. But this is just one part of it, don't you think?
Let's go back to Stephen in New York. Stephen, as far as the pressure on the planet is concerned and the ancillary problems that living longer and bigger populations might bring, what are your thoughts?
Well, this is an issue that we're going to have to deal with regardless of what we do about aging. And I think that we'll be better off having people on the planet that are cognitively intact, that are healthy, to solve the problems. Because whether we do anything about aging or not, the global population is going to keep growing unless we find a way to convince people to reproduce less, and the pressure on the resources will continue. I'd like to point out that 100 years ago, people were saying, look, we've got too many old people, what are we going to do? And somehow we've muddled through for the last century. I'm very confident that humans will find solutions to these basic problems.
You mentioned earlier on that, you know, the human experience throughout time has been that we've basically been living longer and longer and longer. There's a fairly natural progression of our aging. But how far do you think this is going to go, irrespective of whether this particular drug does what some people are claiming for it, right, or whether we find another one? Is that sort of trajectory going to continue, do you think?
Well, people in the aging research community debate this a lot. My personal thoughts are that we now know how to keep animals healthy roughly 20 to 30% longer, many ways. And so I think some of those are ultimately going to be translatable to people. So increasing our healthy life by another 20 to 25% seems to me achievable. Beyond that, I think we start to get into the realm of science fiction or science hope rather than science fact.
All right, well, let me ask you when we might actually see some result from these human trials, and if they prove positive, when we might actually see this being prescribed to everybody.
Well, we hope very much to have results on this metformin trial within 5 years. And if those results are positive, then we would think, because this is a drug that's already approved for human use, that it could come into widespread use almost immediately. It would just be a question of convincing physicians to prescribe it to people of a certain age that had no predisposing health problems to start off with.
Very quickly, aren't we in danger now that, having seen this, everyone's going to be rushing to their doctor and saying, give me some of this stuff?
Probably, and I hope that the doctors would resist that pressure for now.
All right, Stephen Ostad, Dinesh Nair in Singapore. Thank you very much indeed for being with us.
Thank you.
And that's it for Between the Lines for tonight. Our show is available online. channelnewsasia.com/video is the address. Goodbye for now.